Hello, hi, good evening. So we'll just start the class. Right, so I will be teaching you some topics on three series, okay, so which they will ask you on your interview. So tell me what are the structures of heart and what are the functions? Teju, tell me. I hope my voice is audible to you all.
Yes, yes,
Yes.
yeah.
Yes,
It is made up of four chambers, uh, covered by pericardium, uh, 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 right atrium, four chambers are right ventricle, left atrium, and left ventricle. Uh, through the pericardium, pericardial fluid is accumulated to protect the heart from electrical or outer shocks. And there is a valves, four types of valves called mitral valve, tricuspid valve, aortic valve, and coronary valve. Uh,
Okay,
Aortic
okay,
and
thank you.
coronary.
Thank you, thank you, thank you. Thank you. You were good. Thank you. Um, so I'll just pick someone else now. We'll see how many people know about heart and functions. Nikhil, tell me what are the valves of heart?
Mitral valve,
No, and I'm asking Nikhil.
bicuspid. Sorry.
Mhm. Okay, mitral valve, tricuspid, bicuspid. What else? You have, yeah, aortic valve and pulmonary valve. Okay, right. So there is one exception in heart. Like we all know, right? The arteries carry the oxygenated blood and the veins carry the deoxygenated blood. But here, there is an exception. So which artery carries the deoxygenated blood and which vein carries the oxygenated blood? Can anyone tell me that?
Pulmonary artery.
pulmonary artery,
Pulmonary vein.
yeah,
Yeah.
pulmonary.
Yes, so pulmonary artery carries the deoxygenated blood to the lungs for purification. And once it is purified, the oxygenated blood will be brought back to the heart through pulmonary vein, right? So, so what are the coronary arteries? Any idea? So we also have arteries which
Which
supply blood to the
supplies,
heart, right? So like
yes,
yes, we all know that our heart supplies blood to all parts of our body, but also the heart needs blood to pump, right? So that it works. So there are also main arteries, coronary arteries, we call it as, which serves the heart itself. Okay, so we have the left coronary artery. Okay, we have the circumflex artery. Like this left coronary artery divides into two branches. We have the circumflex, right? And we have the left anterior descending artery, or we call it as LAD, L-A-D, otherwise left anterior descending artery. Then we have the right coronary artery. So, so as I told you, left coronary artery divides into two branches, circumflex and LAD. The circumflex supplies blood to the left atrium, okay, and at the back of the left ventricle, and the LAD, the left anterior descending artery, supplies blood to the left ventricle and the front of the septum. Okay, then we have the right coronary artery. So this supplies blood to the right atrium, right ventricle, okay, and also at the back of the septum. Okay, so this you should be knowing. So what is the function? Like how does it function? Okay, what are the layers of heart? Kiran, tell me what are the layers of the heart? Which is the outermost layer?
Myocardium, pericardium,
Okay, which is the outermost layer of the heart?
pericardium. I'm not sure.
Epicardium.
Epicardium, right?
Epicardium.
Yeah. So the the middle layer or the muscular layer is called as myocardium, and the inner layer is called as the endocardium. Okay. Um. So epicardium is actually she told pericardium. It's actually right too. Why? Because epicardium is one layer of the pericardium, right? So so do you guys know about the electrical conduction of heart? Like name me some natural pacemakers of the heart.
Yes.
Anyone? Sangeeta. Sangeeta, tell me, Sangeeta.
ACL.
Sorry?
ACL node.
Okay.
The natural pacemaker.
Mm-hmm. So SA node and AV node, right? So we have the SA node, sinoatrial node, which sends the signals. Okay. And we have AV node, atrioventricular node, which carries electrical signals from our heart upper chambers to the lower chambers of the heart. Then we also have the bundle of his Purkinje fibers, right? We have the left and right bundle branch. So all these sends electrical impulses so that our heart ventricles contract and pump out the blood. Okay. So what are the common conditions that disorders that affect the heart? So we have common conditions like arrhythmia, right? So arrhythmia is nothing but the heart beats too fast or too slow, like it's kind of irregular rhythm. Okay. So that is one condition. So we have the tachycardia, bradycardia. So all these are types of arrhythmias. So what is tachycardia? What is tachycardia? What is bradycardia? Yes. And what is sorry?
Bradycardia is slow water.
Yeah. So tachycardia is like your heartbeat will be very fast, and bradycardia is like a very slow heart rate. Okay. Then we have conditions such as congestive heart failure. So what happens is that the heart will become very stiff or it will become very weak and it won't have the proper function, like it couldn't function properly, like its main function is to pump blood throughout our body, right? So that itself will get very weakened, okay, so which will lead to congestive heart failure, right? Then we have the cardiomyopathy. So it is nothing but the heart muscle will become enlarged, okay, there might be thickening, okay, or stiffening of the heart muscles, okay, the outer heart muscles or the middle heart muscles, okay. Then we have the CAT. We call it as coronary heart disease. So coronary artery disease is nothing but um, plaques will be formed inside the coronary arteries, like as I told you, like circumflex artery or right coronary artery, left coronary artery, or left anterior descending artery. So all these are the coronary arteries in which plaques, or we call it as cholesterol in a very layman language. Why? Because cholesterol gets deposited in the arteries. Okay, well, otherwise in a medical term we call it as plaque. So this plaque buildup will actually lead to very narrowed coronary artery, so that what happens, the entire once it becomes narrowed there won't be proper supply of the blood. So then what happens, that area becomes like starts dying, okay, without proper blood supply, and it becomes it's like we call it as ischemia, the loss of blood supply to that particular area, which will in return will turn to heart attack. Okay, or we like the patient might get angina. Okay, or we can call it as myocardial infarction. Okay. Um. So also sometimes diabetes also, like high blood sugar level, can also play a major role in a patient who is having heart disease. Okay. So that is why they tell the patients to normalize their blood sugar level, and as well as the the blood pressure too. Why? Because these plays a major role in heart disorders. Okay. So as I told you, a heart attack, it is nothing but the coronary artery gets blocked, okay, and the oxygen gets cut off. One second, guys. Why is she asking now join or not? Like, I mean, it's very clear the message. Right. I don't know what's going on, right? Okay. Then we also have disorders like heart valve disorders. Like if your heart is not, like your heart valve is not working properly or it's not working right, then you'll get a mitral valve prolapse, okay, mitral valve dysfunction, or tricuspid valve prolapse or tricuspid valve regurgitations, and all these can happen to your valves. Okay. Then, if there is any inflammation in your heart's lining, like pericarditis or myocarditis, endocarditis, that also can happen, right? So these are the common conditions which you can see in day-to-day life. Then coming to the common signs and symptoms of heart condition. So most common symptom is chest pain, right? Patient who is having a very weak heart or is having a history of cardiac diseases, right? So he or she might have chest pain on and off. Then the patient's second most important is the palpitations, right? The palpitations may be so loud that even the opposite person can feel the patient's palpitation. So that is one condition, right? If a patient has a heart condition, palpitations will be very loud. Then it will be like increasingly, it just increases like palpitations, like the patient will feel that the heart will burst. That's how it feels like. Then the patient might get dizziness. That is a very main sign of a heart disease. Then patient might get shortness of breath, like on exertion or on rest, the patient will have shortness of breath if the patient has a heart condition. Then fatigue. Patient will feel very tired. Okay, and also the lower extremities will get swollen. There might be, a visibility of very swollen veins in the lower body. Okay, so that these are all the signs and symptoms of heart conditions. Okay, so mostly the procedures done to check the health of the heart is nothing but EKG, electrocardiogram, echocardiogram, chest rays, chest X-rays, blood test, okay, cardiac catheterization, CT, MRI, stress test, TMT, we call it as, okay, treadmill test. So these are all stress tests, okay. So more like common treatments, like mostly they will try to give medications, okay. That is one thing. If the patient has a blood pressure or any such things, they will give medicines for blood pressure as well as they will give anticoagulants to prevent clotting in future. Okay. Why? Because the patient might be hypertensive, so it can cause to create a thrombus or to create a clot inside the blood inside the vessels, which can get blocked, okay, in the arteries, and can also cause an heart attack, right? Then if that is all is not working, then patient will get a pacemaker done or will get a defibrillator placed. If the patient has arrhythmias, tachycardia, atrial fibrillation, all these conditions, then the doctor, the surgeon suggests the patient to get a pacemaker fixed or the defibrillator fixed inside the patient. Okay, or then the patient might get an angioplasty done, a stent placed, or can, like the final operation can be a CABG. Okay, CABG will be done for the patient or to bypass the artery which is causing the issue. Okay, if these are all is not working, then this they will lead to amputation of the legs. Okay, but because as I told you, I mentioned earlier, if a patient has a heart condition, the blood veins protrude in the lower extremities. because of the occlusion or stenosis of the arteries in the lower extremities can also cause heart attacks. Okay, so if it is like uncontrollable, even if a bypass surgery fails, the last resort, okay, for the patient is to cut off their legs, which, like they'll just cut off from below the knee, okay, so that the stenosis and occlusion doesn't get affected on the upper extremities too. Okay. So before that, they will do all these procedures. They will do pacemaker, they will do angioplasty, they will do stent, everything. Like they'll try everything. Okay. Right. Now coming back to the procedures. So, pacemaker and defibrillator. So pacemaker is an device, medical device, which generates electrical impulses um, delivered by an electrodes so that the heart muscles can contract and regulate the electrical conduction of the heart, right? So if the natural pacemakers doesn't work, if the natural pacemakers fail, then the patient will have arrhythmias, atrial fibrillations. Okay, so all these conditions, sick sinus syndrome, all these conditions, these are types of arrhythmia. Okay, it can be a very fast heartbeat, it can be a very slow heartbeat. So mostly pacemaker and defibrillator. You can see defibrillator in movies such as I'm not sure. I remember a Tamil movie, Raja Rani. Okay, so there like Nasriya, she meets with an road accident and she dies. So what they do, they will use a defibrillator to, uh, you know, um, they use it to perform the pacing of heart, like so that she gets like her heartbeats comes and like she can get revived. But that is an external defibrillator. Okay, so they'll just use a gel and they'll just place it on the patient's chest. But here we will be talking about the implantable defibrillator. So that will be, it's a small device system which will be placed inside the heart. Okay. So pacemaker and defibrillator both are same, but there is a slight difference you need to know. Why? Because pacemaker is placed for patients who have very slow heartbeat, or we call it as bradycardia. Like patient might be suffering from bradycardia for so long, so he needs a pacemaker. Okay, so they will choose a pacemaker instead of defibrillator. Okay, but defibrillator are also same. It's a kind of an implantable device system inside your body to perform, pacing of heart. Like it can regulate the electrical conduction of the heart. But the only thing is that it is used when patient has a very dangerous arrhythmia. Like for example, tachycardia, very high heartbeats. Patient might be in a stage to get heart attack anytime. So if that is a thing, the provider or the surgeon will decide to place a cardio water defibrillator inside the patient. Okay. Okay. So they'll just ask in the interview, they'll ask you what is the difference between pacemaker and defibrillator. You can say all these things, right? Both a pacemaker and defibrillator are medical device system which generates electrical impulses, okay, delivered by the electrodes to contract the heart muscles, and so that the electrical system of the heart will have a normal function. Okay. Now, so this device system has two parts. One is battery, we call it as pulse generator or a battery. Sometimes in the OP chart they will use as pulse generator, sometimes they will use it as battery. Both are same. Okay. Then we can see one or more leads. Leads are nothing but electrodes. Okay, so through this electrodes, the electrical impulses generate through the electrodes. Okay. Um, so these are the two parts of your device system, whether it is pacemaker or defibrillator. So the pacemaker and the defibrillator can be inserted through two ways, that is through subcutaneous way and through transvenous way. So mostly 99% they inserted through transvenous, through the vein. Okay. So we have, it is very simple, guys. We have a chart flow with me, so I'll just send you that. So we have CPT starting from 33216. So 33216, this starts, this is for the implanted pacemaker. You can see here, right? So I'll just tell you, just give me a second. So talking about the parts of device system, that is whether it is pacemaker or the electrodes. So these are placed in different, both are placed in a different location. Okay. So I'll just tell you that. We also have lidless pacemaker. So lidless pacemaker is nothing but it's like it's a kind of a modern pacemaker where you don't have two parts. You only have one small battery. Inside that you have the leads. So it will perform the function of battery as well as the leads. Okay, it's just a small button size. Okay, we call it as leadless pacemaker. Okay, so what the surgeon will do is that they will make an incision, okay, to access a vein, and once they, get into the vein, they will use a fluoroscopy. Okay, definitely they will use some imaging. Okay, so that the placement is in the right vein, and they will thread the leads and wires through that vein and attach them to a point to, like, the one chamber or the two chambers, or it is in the multiple chambers. Okay, so the leads will be attached to the pacemaker device. Okay, then they will place the battery. Okay, they'll create a small pocket under your skin on your upper chest. You can see the image there. So you can see the battery placed here. Okay, so this is under the skin, under your collarbone, near your collarbone, and the lids will be placed into your chambers. So this one is in the right atrium. The other lead is in your your right, yeah, right ventricle, right? So this is a kind of a 12 chamber lead placement. Okay, so if this leads can also be placed in the left ventricle too, right? They will insert one more lead into the left ventricle. So if that is the case, then it will become as multi leads. Okay. So if it is like single, then only one lead will be seen in the right atrium. But here we can see two leads in the two chambers of your heart. It means that it is dual chambered pacemaker insertion. Okay. So that's how you have to code for. Okay. So as I told you, a surgeon will create a very small incision. Okay. Inside your chest and insert the leads through the incision, then attach the leads to your chambers. Okay. Then he creates a small pocket under the skin near the collarbone and place the what to say, the battery or the pulse generator. So that is how the procedure will be. But our um, our work is to find out whether it was initial placement, or it was a revision, or it was just relocation of the skin pocket, or it was a placement of the the I mean it was just a removal of the battery and replacing the battery alone, or it was removal of the leads and replacing the leads alone, or it was totally removing the device system itself and replacing it with a new one, or it is just been what to say, came for some reading. We call it as a revision. Okay. So these are the conditions we need to check for. You can see the CPTs over here. Or if they are repositioning. Okay, so you have a lot of CPTs over here. So if they are inserting a single transverse electrode, permanent pacemaker, or implantable defibrillator. So this CPT is for pacemaker and as well as the defibrillator. Okay, this is transvenous single lead. Okay, so they are placing a single leads. This is performed for the leads. Okay, that is what we call as electrodes. If they are placing dual leads, in the sense they are only replacing the leads alone. The pulse generator will be left alone. Okay, pulse generator will be there. They are not replacing it, but they are replacing the electrodes. Okay, in that if that is the case, that if that is the scenario, they are inserting it. Then your CPT is 33217, and you can see over here. So this is for single lead electrode, and this is for 12. Okay, this two CPTs are for same pacemaker and as well as defibrillator. Okay. So this is just these and all they won't ask you in the interview. They'll just ask you what is pacemaker, what is defibrillator. That's all. And they might ask you what are the procedures for the pacemaker and defibrillator. So you can say that there is insertion, there is insertion of leads alone, there is insertion of pulse generator, there is insertion of pulse generator plus the leads. There's a removal with replacement. There is removal, they'll just remove and just leave it. They won't replace it. That is one procedure. Then you need to see whether they've upgraded it. For example, the patient might have a single chamber system, but now again he's coming for an upgradation. So in the upgradation, what they do, they will insert one more, a lead into the right ventricle. So they have already have a single chamber system, that is the lead is in the right atrium. Now they are coming for placing it on the right ventricle also. So it means single chamber system to dual chamber system. So that is what we call it as upgrade. Okay. Or sometimes conversion. Okay. Sometimes they might have a existing system. Okay. Now they are converting it into a biventricular dual system or biventricular multiple lead system. For example, the patient might have only one electrode in the right atrium. Okay, so always when electrode is placed, it will first get placed in the right atrium, then into the right ventricle, and then into the left ventricle. So if there are three electrodes which has been placed in the right atrium, right ventricle, and left ventricle, it means that this is a multiple lead system. Okay, if it is just two, that it means right atrium and right ventricle, then it is dual lead system. So that is one thing you need to be um aware of. Okay. So these are the CPTs for placing the electrodes. We can see CPTs for placing the whole device system to show you. We have 33206. So this is insertion of, mostly you'll see this kind of CPTs. Insertion of new or replacement of permanent pacemaker with electrodes for atrial. See, you can see it here. They are just placing the electrode in the atrial. Okay, then your CPT is 33206. Right? If they are placing in the right ventricle too, then your CPT should be 33207. We call it as dual chamber, dual pacemaker chamber insertion. Okay. Now, if they are placing in both atrial, now if they are placing in the atrial and the ventricular, then it is 33208. Just give me a second, guys. Just be back. Okay. Now, yes, so as I told you, if they are placing the device generator, like device, I mean the pulse generator, they actually place inside the skin pocket. Okay, so whenever you're reading an OP chart, you should make sure that they're creating a skin pocket and they're placing the pulse generator. That it means that this is the term you have to check for. It means that yes, they are placing pulse generator, they have already placed pulse generator, and now they are also going to place the lead. The same encounter. Okay, so if that is the case, if a single lead atrial they have placed, like the single electrode has been placed in the right atrium, then your CPT is 33206. And if it is placed in the single left ventricular, then it is 33207. If they are placed in both atrial and ventricle, the dual placement we call it as 33208. Now, if they are placing the electrode in the right atrium, right ventricle, and left ventricle, then you have to code two CPTs, that is 33208 for 12 leads, and you have to go 33225. Okay, so 12 lead you have to code this. Along with that, we have to code 33255. Okay, so this CPT you should be coding for, why? Because they are placing a pacing electrode, okay, in the left ventricle. Okay, so this is another code and you have to code it along with 33208. It means that they have inserted a pacemaker, okay, uh, as a multi, when multi, what to say? Yeah, so multiple leads has been placed. Like if they are placing in the right atrium, right ventricular, and left ventricular, it is to be meant as multiple leads. Okay, or multiple electrodes has been placed along with the pulse generator. So this is how you have to check for. Okay, you have, whenever you're coding for pacemaker or defibrillator, check whether the pulse generator or the battery has been created, pocket has been created and placed. Then you also need to check what are the lead system, whether it is single, dual, or multi-chamber. Okay, that is one thing. Then you need to check that they have come for removal with replacement or just removal, or they have just come for initial placement, or they just come for relocation. So if they are relocating the skin pocket, okay, if they are just working on that, then you only have to code 33222. If it is pacemaker, if it is defibrillator, we have 33223. So you have a number of CPTs, guys. Relocation skin pocket for pacemaker. This relocation skin pocket for multi implantable defibrillator. Okay, this is very easy actually, but the only thing is that you need to check for all the points in order to code it correctly. Okay. So I'll send you the materials so that you can just check and read it. Okay. So I'll just show you an example. See if you guys can solve it. Just wait a second, guys. My teams. Am I audible to you?
Yes,
sir.
But my teams is stuck. Like I couldn't stop sharing. Okay, fine. I'll just show you the results. So as I told you guys, whenever you're coding for pacemaker or defibrillator, first thing you need to check for is whether they have placed pacemaker or defibrillator. So what is the medical device system they have placed, whether it is pacemaker or implantable defibrillator. Then you need to check the type of device, whether it is with leads or leadless. So for leadless, we have different code set. Okay, that is just one or two, three codes. But with lead, mostly you can see people placing it with leads. Okay, they will go with the traditional, insertion of pacemaker. So definitely it will have leads. Okay, if they are like performing a procedure with the leads only, then you need to check whether they're inserting the pulse generator along with the leads. Okay, so that is one thing. Then you should check the number of leads, whether it is single, dual, or multiple. Then location of the leads. Like as I told you, that is placed in the right atrium, right ventricle, or right ventricle, atrium, right ventricle, right atrium, right ventricle, and with left ventricle. So these are the location of the leads. Okay. Then type of procedure, whether it is insertion or removal without insertion or removal with replacement, or whether it is just relocation, or whether it is just upgradation. Okay. Or whether it is repair. So these are all the type of procedures you need to look for. Okay. So once you get all these points checked, then your uh, the CPT codes will be correct. Okay. Sure. So you can see an example over here. 75-year-old male presented to this emergency room suddenly after he lost consciousness while at home. Okay, so pulse rate 30 beat per minute and blood pressure of 76 by 40 mmHg. Electrocardiogram demonstrate complete heart block with a natural rate. Okay, so 100 per beat. Okay, ventricular rate 30. Insertion of permanent dwell chamber. So they have, they will in the OP chart, they will just tell you what they have done, right? They will just tell you if it is insertion or replacement or removal. Okay, so they'll tell you, and also they will tell you what is the type of device they are placing. Okay, so here you can see insertion of permanent dwell chamber pacemaker system. Okay, so here you can see under fluoroscopic and anatomic guidance, left subclavian. So if they have access left subclavian vein, okay, and the lid is introduced. The ventricular lid is introduced into the subclavian vein. Lid is positioned in the right ventricular apex. Procedure is repeated for another lead and placed in the right atrium. So there now you can see they have placed the leads in the right, the right atrium as well as the right ventricle. Okay, now they're going to create a pocket. So the pocket for the pulse generator is fashioned and inserted a dual lead pulse generator. Both the leads connected to the pulse generator and tested for function. So this testing and all will be inclusive to the CPT. Okay, the pocket is closed with 3 layers of suture. So here, what is the uh, procedure done? Tell me, just I don't want CPTs, nothing. I just want you. I want to know whether you guys have understood the points which I just reiterated. So, can anyone like Divya, can you tell me what is the procedure here? I want Divya to talk.
They have inserted a permanent dual chamber.
Okay. So what else you want to like, there are a lot of checkpoints for in order to code for permanent dual chamber. So what are your analysis on this? So what is the first thing you need to check?
Whether they are already having pacemaker or not, or first time they are
Okay.
inserting or not.
So what do you think about this? What is the scenario? What do you think? Whether it is first time or they're coming for something else?
The first time they are inserting.
Okay, good. So what is the device they're inserting? Pacemaker or defibrillator?
Oh, pacemaker only.
Okay, correct. So is it single chamber or dual chamber?
Dual chamber.
Okay, correct. So what are the leads they're placing if it is dual chamber?
Right atrium and ventricular.
Yes, so right atrium and as well as right ventricular, right? So they are placing two electrodes, two leads, correct?
Yes,
So
yes,
they have
yes.
placed it, yeah. So they have placed it in the two chambers. So that is why we call it as dual chamber, right? And also they have created the pocket for placing the pulse generator. So now you got it, like how to see the points and everything. Now I'll just stop sharing and I'll So now tell me what would be the CPT? Will it be 33206? Or will it be 33207? Or will it be 33208?
33208.
Exactly. So your CPT is 33208. That's it. It's very simple. So the checkpoints are very, very, very important, guys. Okay. Just show you another example. An 82-year-old patient presents with a history of sick sinus syndrome and intermittent paroxysmal atrial fibrillation underwent dual chamber placement. Okay, pacemaker placement 3 years ago. So now you can see that the patient has a 12 chamber pacemaker, which has been placed 3 years ago, right? So he already has one. Okay. The battery of the pacemaker is not functioning and required to be changed. So I think it has come to the end life of the battery. Okay, or depleted battery, we can say. An incision is made of the existing generator, carried down to the level of capsule surrounding the generator. Existing generator is dissected free, and the leads are freed from scar tissue. The pocket is copiously irrigated. The new generator is inserted in the pocket and attached to the existing leads. The device is programmed. The skin pocket is closed with sutures. So, Badusha, tell me, what do you understand by this question?
The patient previously has the pacemaker. Now uh, they exist the generator. They
Okay. They're going to remove
uh,
the generator. Okay. They're
and
just going to remove. That's all.
no, the,
So,
they
tell me.
inserted new generator in the pocket and they closed the.
Okay. So here they have only touched the generator. They have not done anything to the leads. Correct? Yes, you
Yes.
all agree with me? Yeah. So here, what is the thing? We just have to check that the 12 chamber, the patient has a 12 chamber 3 years ago, and now it required a change. Okay, the battery, they are just, removing it and replacing it with a new generator. And they attach it to the pocket, they place it in the pocket, and they attach that generator into the existing leads. Okay, so here we need to code for the removal and replacement of the pulse generator. Why? Because the provider removed a previously placed pulse generator from the patient and replace it with a new one. And this generator will be connected to the existing leads. So whenever you're coding for removal and replacement, you need to check if the connection which has they've given to the existing leads are single chambered or dual chambered. So here we can see it is a dual chamber. So they have two electrodes, right? So according to that, our CPT changes. So I'll just show you. So the removal of permanent pacemaker pulse generator with replacement of pacemaker pulse generator. This is for single lead system. Ours is dual lead system. So we need to code 33228. That's all. If it is in the multiple, for example, if it is like one existing lead is in the right atrium, one existing lead is in the right ventricle, and the other lead is in the left ventricle, then it is to be known as multiple lead system. Then your CPT will change to 33229. As they have mentioned that it is a dual lead system, you need to put it as 33228. Any doubt, guys? Any clarification?
Ma'am,
Yeah, Teju, tell me.
hello. Uh, Ma'am, there is no dual double lead system is present in the question, right? How we will you identify that is double lead
Sorry?
system, ma'am?
Sorry?
Uh, there is no dual chamber pacemaker is not present in the question, ma'am.
Is that so?
Repeat.
Can I
Uh,
show you the question again?
yeah, yeah. Just once.
Please read the question.
Yeah, sorry, sir. Yeah, it's dual chamber, ma'am.
Yeah. So they will mention it as whether it is dual chamber, single chamber, or multi-chamber. If they are not mentioned that, see, 99% they will mention it. But by chance, if they don't, then you need to read the OP chart fully. Then understand that if it is like they will mention in the electrodes, one electrode is in the right atrium, one electrode is in the left, the right ventricle. So as I told you, right, these are the terms you need to check in. These are the points, okay? So if it is in just in right atrium itself, it is single chamber. If it is placed in both right atrium and right ventricle, it is dual chamber. So this is how you find out if they have not mentioned it in the OP. I mean the header or somewhere. But definitely 99% they will mention it. So you don't have to worry about it.
Yeah, full.
Okay. What about Kiran, Divya, Badusha, Sheikh, Nikhil? You guys are okay? Like you guys are good? Sangeeta, Swapna, Bhuvaneshwari.
Yes, sir.
Okay. What about Nikhil? Sheikh. Who said yes now?
Myself, Sheikh.
Okay, yeah, I got. What about Nikhil? Okay. It's actually little confusing, but once you get into coding, like once you get into this coding, the pacemaker and all frequently, you'll get used to it. It's very simple, but the only thing is that you have to understand the checkpoints. What and all have you have to search for in an OP chart. Okay. Bhuneshwari. So we'll now see about bronchoscopy. So what is bronchoscopy, guys? Any idea? Have you guys heard about bronchoscopy?
Study.
Huh?
Lung.
Yeah. So it's a kind of an scopy procedure. So you'll see a lot of questions in this, lot of charts in this, and they will ask you certain interview questions, which I will be telling you. So bronchoscopy is an endoscopic procedure that allows a surgeon to, put a scope inside the lungs through nose or through mouth. Okay, so it can visualize the bronchi, okay, the trachea, the bronchi, the bronchioles, and the lungs too. You can visualize the lungs too. Okay, so we have like certain coding elements like we have CPTs from starting from 33622. Sorry, 31622. I think, yeah. So this is for diagnostic purpose. So if the patient comes in and gets a scopy done, okay, then you'll be coding it as the 31622. Okay, so this is just for diagnostic purpose. They'll just visualize the lungs, the bronchus, the bronchioles, the trachea. Okay, they'll try to find out if there is any malignancy or anything. Then they might do some cell washing too. Okay, so if that's the case, then your CPD is 31622. If they are using any brushing or protected brushing, so it's a kind of a method in order to take away the washings from the lungs. So they'll just use some brushing. Okay, this it's a kind of a tool or instrument used to kind of um, you know just cure it from the lungs. Okay, it won't entirely cure it. It won't do that purpose, but it has some bristles which can collect the cells from the lungs or from the wall of the lungs or from wall of the bronchioles. They will just inject a saline solution into the trachea and bronchioles, okay, and then they'll just aspirate it. So with that, they will get some cells for study for cytology purpose. Okay, so if that is the case, you'll be coding 31623. In your OP chart, they will mention what um bronchoscope, what kind of treatment they have doing through the bronchoscope. They'll just tell you, like they'll just document in the OP chart. Okay. Then you have the 31624. So this is for lavage, so washing. So they're kind of inserting some 2 to 3 solutions and washing and taking all the wash or lavage we call it as. Then your CPT is 31624. So mostly they will use this as BAL. Okay, BAL. It is nothing but bronchial alveolar lavage. Okay. So if they're taking any biopsies, so if they are taking any biopsies from the inside the bronchus or inside the endobronchial, so deep inside the bronchus or around the bronchus or bronchial, then your CPT is 31625. Okay, whether they are taking it for single time or multiple time biopsy they're taking, your CPT is 31625. Yes.
Are you sharing another screen? CPT1?
Oh, sorry. Is it visible now?
Yes, yes.
Okay, I just forgot. Yeah. So these are the CPTs, guys. This is telling you now. So this is for BAL. Okay. So this for biopsies, whether it is single biopsy or multiple, you just have to report with one CPT. If they are placing any fiducial markers, okay, to mark a lesion or tumor, then your CPT is 31626. Okay. If they are using a computer for navigation, it is very important, guys. Whenever, sometimes this is an add-on code, okay. Sometimes they might do a BAL, okay, they might do a bronchial alveolar lavage, they might do a biopsy, endobronchial biopsy. Plus, they will mention that they all did this procedure through computer assisted navigation. Okay, so in that condition, in that case, you will be coding 31624, 31625 along with 31627. Because this is an add-on code, you need to report it. Okay. Now, if they are taking biopsies from through through the bronchus, okay, through bronchus, transbronchial lung biopsies, okay, then if it is from single lobe, your CPT 31628. Okay, so this is they are just taking a biopsy. But if they are taking a needle aspiration biopsy, TBNA, this is TBBX. Okay, so this is TBBX and this is TBNA. So these are the short forms they will use um in your OP chart. They will use as TBBX. Like that's how doctors use, right? Then you have TBNA. They won't just abbreviate all those. It's a time taking for them, so they'll just use short forms. Okay, so if it is TBNA, then your CPT is for one lobe, it is 31629. Okay. So you need to check whether they're taking a biopsy or they are taking a needle aspiration biopsy. Okay. Now, if they are placing any stents to dilate any strictures in the tracheal or in the bronchial, then your CPT is 31631. Okay, so this is again for plural, guys. If they are placing 2 or 3 stents, your CPT is 31631. Okay. And now this is an add-on code for what we saw just now. So this is for lung biopsy. If they are taking biopsies from each additional lobe, you have to append it, report it with the add-on code. And if they are taking needle aspiration from the bronchus through the transbronchial, from each additional check whether it is biopsy, just biopsy or needle biopsy. Okay. So if they are removing any foreign bodies, okay, then your CPT is 31635. So if they are placing any stents, okay, bronchial stent, then your CPT is 31636. This is tracheal stents, guys. Okay, 31631 is for tracheal stent, and this is bronchial stent, 31636. Okay. And if for each additional if each additional major bronchus they have stented, then you have CPT 31637. And if they come for revision of that stent, then you have 3163E. Now coming to the main part, that is EBUS. Okay. Just give me a minute, guys. So if they are doing EBUS, so EBUS is nothing but endobronchial trans ultrasound, that is ultrasound guided sampling. Okay, so if they are doing any sampling or biopsies from the lymph node stations, okay, so 31652 you can see here. This is for EBUS, okay, for 1 or 2 lymph node stations. So in your OP chart, they will mention from how many lymph node stations they have taken the samplings or biopsies. So if it is 1 or 2 lymph nodes, then your CPT is 31652. If it is 3 or more than that, then it is 31653. Okay. Now, if they are doing transendoscopic endobronchial ultra, that is EBUS, okay, for peripheral lesions. So peripheral lesions are lesions nothing but sometimes the patient might have a lesion over here in the edge of the lung. So that is what we mean by peripheral lesion, because it is in the peripheral area. Okay, it's away, it's a little bit far. So what happens is EBUS can track it down and can take a a biopsy or in anything, okay, aspiration or anything. It can just even click a image in of the peripheral lesions. If that is the case, then your CPT is 31654. So in your OP chart, they will mention if they are finding any peripheral lesions in the lung, the apex of the lung, and they are doing EBUS for that, then you need to add this add-on code. Okay, so they will ask you in the interview what is EBUS. So what do you understand by EBUS and what is done in EBUS? They'll just ask you, EBUS is done to locate or to biopsy which part of the lungs. They'll ask you like that. So you can say that EBUS is used when they are, taking any aspiration or biopsies from the lymph node station. Okay, so actually lymph node system, okay, is divided into 14 stations and 7 zones. Okay, so this is for mapping the cancer staging. Okay, so this is been developed by the International Association of the Study of Cancer, Lung Cancer. Okay, so they have divided the lymph system into 14 stations, sometimes only 3 stations, sometimes only 4 stations or 7 stations. Okay, but if that is what, if it is more than 3, right? So if that is the case, then you'll be coding 31653. But if it is just 1 or 2 lymph node station, then your CPT is 31652. Okay, so whenever they ask you what is EBUS and what they do, so you can say that EBUS is nothing but they will do an ultrasound within the bronchi. Okay, and within the bronchi, they will do ultrasound for the lymph nodes. So lymph nodes are nothing but it's a kind of a various points. So those are kind of a very small nodules. Okay, okay, so lymph system returns fluid from the tissues back to the bloodstream. So it has a function of supporting the immune system. So whenever patient has a cancer, lung cancer, the fluid will get drained into the lymph system, right? So lymph nodes fight against the cancer cells, but if the cancer cells are vigorous, what happens then? It gets metastasis to the lymph nodes. To check if there is any metastasis of the lymph nodes, they will do EBUS, right? They will do this aspiration biopsy from the lymph node stations. Okay, so that is one thing you can say. Then for peripheral lesion, as I told you, so if they are, doing any sampling or any, imaging of the peripheral lesions, okay, in that case, you can code 31654. It's an add-on code. Okay, so peripheral lesions are nothing but as I told you, it's a kind of a difficult to reach areas. Okay, why? Because it is in the corner, it is in the margin, right? So it is difficult to reach. So they can easily view it through the EBUS. Okay, so once the provider completes the examination, once he completes the visualization, they will take biopsy or they might treat that peripheral lesion too. Okay, so if that is the case, then your CPT is 31654. So I'll just share your question. So you can see here, 70-year-old female has a persistent infiltrate in her right lower lobe. So in her right lung, okay, in her right lower lobe of her lung, she has a infiltrates, okay, which does not resolve despite she got a lot of antibiotic therapy. So the patient was being taken to the hospital for bronchoscopy. So following, mostly they will do, give topical anesthesia. So once it is been done, bronchoscope will be inserted Okay, then using fluoroscope, I told you, right, whenever there is any bronchoscopy inside any scope, sometimes they will also do some fluoroscopic guidance. Okay, so why? Because they will be inserting a catheter, right? So for that, they will use a fluoroscopic guidance. So here they are placing catheter in the through the bronchoscope. So once the catheter has reached the infiltrated area, uh, the catheter seal is broken and a contaminated brush is used to collect specimens for culture. So here what happened is that the catheter seal is broken and brush is used to collect the specimen. So it's a kind of an uncontaminated brush, or we call it as protected brush. It won't get contaminated easily. Okay. So here you can see the patient has got a bronchoscopy done, and through bronchoscopy, surgeon is doing brushing and collecting the specimens for culture. So what would be a CPT? So just share the screen. What is the CPT here? 3-1.
623.
Yes, 31623. Why? Because they're doing brushing and collecting the specimens, right? So you need to check a scope is bronchoscope. What the procedure done is brushing. Okay. And fluoroscopic guidance is always included in the CPT codes. Okay, you don't have to code it separately. Okay. I'll just show you one more last question so that this time. A 68-year-old female presents with peripheral alveolar infiltrates in the right lower lobe and right upper lobe that have been unchanged for 6 weeks. Bronchoscopy is performed. No lesions are visualized. Under fluoroscope guidance, a biopsy forceps is inserted in the area of infiltration in the peripheral right lower lobe. Total 6 lung biopsies were obtained, each with biopsy forceps under fluoroscopic guidance. The same procedure is repeated for the right upper lobe. Specimens are submitted in a container. Post-procedure chest X is obtained to evaluate for possible pneumothorax. Okay. So here what they have done is that the patient has a peripheral alveolar infiltrates. Okay, it is not a lesion or anything, it's just an infiltrates, kind of a lesion or a tumor. Okay, it's just a kind of a small infiltrates, we can say. Okay, kind of a dust particles. They call it as infiltrates. Okay, so the patient has it in the right lower lobe and the right upper lobe. Okay, it has been unchanged. So again, the patient comes for a bronchoscopy. So they have done 6 total lung biopsies. Okay, so 2 lobes and 6 lung biopsies. So they have done what they have done, guys. They have done transbronchial lung biopsy. Why? Because they are taking biopsies from the where from the bronchial lung biopsy they have taken. Okay, so here you can see that they have taken the 2 lobes. One is the right lower, the other additional lobe is your right upper lobe. Right? So here our CPT will be 31628 and 31623. Show it. Okay. So 31628 is for the single lobe, right lower lobe, and 31622 is for additional lobe, that is right upper lobe. So this is how you have to code for the bronchoscopies. Again, fluoroscopy is inclusive to the CPT. You don't have to code it separately. Okay. So I will send you the material so you can go through it Okay, tomorrow we can meet by 8. Yes, guys. So I am planning to complete the portion by 2 to 3 days. Okay, so this week I need to complete. So we'll just see once the topics gets over. We'll go through the interview questions. Okay. So, okay, guys, then see you tomorrow by 8. Thank you.
Thank you, Sonu.
Thank you, sir.
Thank you.